So for what we expect now, since you gave birth for at least 3 days, we're going to expect lochia rubra, which is your dark red blood, right? Sometimes it can be accompanied by clots, but that should not be much of a fright as long as the clots are at least coin size and are not persistent in that regard, right? But we get very much concerned now if we get clot sizes that are like an egg size. That's when now we tend to question, because such a sign, it might indicate, or rather it might be a contributing factor for you to bleed excessively, of what we call postpartum hemorrhage, of which we want to attend to immediately. Hence why we do regular pad checks, right? And so looking at your pad here, I'm seeing it's lochia rubra, which is red as expected, and your pad is not fully swelled, you know. And when last did you check? Did you change your pad when you came here?
Yes.
Oh, okay, all right. So every 2 hourly, please go to the bathroom, you change your pad, and we've got a nice disposable bin for pads there, right? Okay, and the second stage of your vaginal discharge, we are expecting to have what we call serosa. So that's from third day to 10th day, and the presentation of that blood is actually brown yellow, right? So you expect it from day 3 to day 10. Then going forward now, which is the last one, which is serosa, which is a bit quite clear or yellowish, right? And obviously your discharges should never have an offensive smell. If you do have an offensive smell, I would encourage you that you go to your nearest local clinic or your GP, so that you can be assessed for any form of infection and get proper antibiotic treatment, right? Thank you very much, man. So now having done the pad check, I'd just like you just to face that other side for me, man. Let me help you by bending your knee and slowly. Okay, let's go. All right. Okay. Okay, just wait a while for me, mommy. Okay, thank you. All right. So what I was basically checking there when I moved the mother laterally there is to check for any pool of bleeding, because sometimes, you know, the pad cannot absorb the blood, and it can just seep through right to the anal area, and we can have a pool of bleeding, and we can easily identify that excessive bleeding, you know, and identify postpartum hemorrhage, right? And also what I checked there, I checked for hemorrhoids within the anal area. Hemorrhoids basically being protruding blood vessels from the anus or the outer anal opening there, which obviously every mother is subjected to get, because the uterus then presses down onto the blood vessels there by the buttock area, right? And then I also now do my effective check of the perineum. So with the perineum, we know that our mother had our our episiotomy, which obviously the reason or indication was because the baby is too big, right? So being that, obviously we did cut, right? And what I'll check for firstly is the presentation of the sutures, if whether it's well connected, right? And that the tissue is not over the other, or, you know, we have seen exposed tissue within. So looking at this, they used interrupted suturing. So I see that your tissue is well connected and there's no space within. So we know that we're expecting effective healing there. And I'm checking for redness around your perineum, even the heat. So indeed we have fairly, you know, fair redness, because obviously of the episiotomy, which is, you know, harm done by the perineum. But it's not so you know, a red alert, you know, it's just normal inflammatory, you know, signs, but I don't see any signs of infection whatsoever, or any signs of bleeding, or, you know, bruises whatsoever. So with that being said, I thank you here, mommy. So we'll be just going further down now to check for any signs of DVT. So obviously, since you are laying on bed, you know, mostly you are subjected to getting what we call DVT, which is deep vein thrombosis, right, where clots might form, and obviously that clot might end up going up because of venous return and might cause, a heart-related problems or cardiovascular-related problems, you see. So with that being said, obviously, since you gave birth, it is normal for you to have a high a high percentage of coagulation. That is normal, right? So now let's just check if you have any signs of different thrombosis. I'll just bend your leg, just like that. Just relax for me, Namami. And now dorsiflex. Do you feel any pain around your calf there when I do this? You don't? Okay. Do you feel any form of tension? You don't? Okay. So I can feel within your legs also, it is nicely fairly warm. It's not hot, right? And I don't see any veins protruding whatsoever. I'll also check for the opedi pulse. I'll just bend your toe, then let's feel. Okay, there's normal pulse there, right? And it's not disturbed whatsoever. Okay, and I'll do the same examination on your other leg, your right leg. So let me just move in this side. Let's bend your leg for me. Okay. Dorsiflex, any pain, mommy? Nothing. Okay. And I can see your leg, it's nicely warm, fairly temperate, right? No any signs of protruding veins. And your pulse here is also active and well, right? So we are basically done, Mama. And how are you feeling?
I'm tired.
You're tired. I understand. Labor, it's actually labor. It's hard labor there, but that's a normal symptom with that, so there's no need to worry about that. So if you feel any form of dizziness, or persistent headache that you cannot bear, just let me know, all right? And as I said, with the general examination done, your clinical condition is stable, of which we want to maintain it there. So we'd also encourage you that, just embrace the whole diet that we have, even though we may not have much salt or spices, but it's very healthy for you, right? Okay, man. So with that being said, I trust that you'll have a great day further, and I'll continue coming for routine checkups. Thank you, man. Okay. Oh, man, sorry, I actually forgot. Do you have any pain feeling? Yeah, you do.
Yes,
right? Okay, let me check. And if you give me for the scale from 0 to 10, how much would that pain be? Okay, a 5. So it's very low. Okay. So I see that the doctor prescribed for you 50 milligrams of tramadol and 100 milligrams of Panadol paracetamol. So I'll bring that for you so that it can help to alleviate, or rather to better your pain for that. And you'll have a nice sleep, and you will be able to bond with your baby again. All right. Thank you very much.
Thank you.